Hello friends, today I am going to explain you about differences between hyperthyroidism and thyrotoxicosis. Some we may think the hyperthyroidism and thyrotoxicosis both are same, but actually it's not same. Let me tell you like differences between hyperthyroidism and thyrotoxicosis. The hyperthyroidism means the syndrome resulting from hyperactivity of the thyroid gland, which produces excess amount of hormones, which means like excess amount of thyroxine in the blood, which is coming from the thyroid gland itself. If it comes from thyroid gland itself only, we can call it as a hyperthyroidism. I mean if you take like thyroid gland, it will produce a more amount of some amount of thyroxine, right? That thyroxine, if it comes from the thyroid gland itself, it will call as hyperthyroidism. But in thyrotoxicosis, we can see like the definition is like symptoms and signs of increased metabolic rate and sympathetic activity due to increased amount of thyroid hormones. I mean the excess amount of thyroxine in the blood, which can be due to thyroxine pills. It can be from exogenous causes. For example, like some people who are taking thyroxine pills for the weight loss. So this patient is thyrotoxic but not hyperthyroidism. So you can understand the main difference. The hyperthyroidism means the patient, he will have thyroxine in the blood, high amount of thyroxine in the blood due to from thyroid gland itself. Okay, like thyrotoxicosis means the patient can have excessive amount of thyroxine, which produced not from the thyroid gland, but it can be from outside, exogenous causes. So we can like divided the causes of thyrotoxicosis into which can be associated with hyperthyroidism and not associated with hyperthyroidism. Okay, like associated with hyperthyroidism causes we can think as primary hyperthyroidism and secondary hyperthyroidism. Primary hyperthyroidism means primary. What do you mean by primary? Primary means the problem in the gland itself. When we are talking about hyperthyroidism, which gland we are going to talk? I mean, we are talking about thyroid gland, right? So if we are talking about thyroid gland, the problem will be in the thyroid gland, right? So primary means problem in the thyroid gland itself. So it can be Graves disease, and toxic adenoma can be, and Plummer's disease can be. Graves Graves means diffuse hyperthyroidism state, right? So this can be diffuse hyperthyroidism state. And toxic adenoma means solitary hyperthyroidism state. And Plummer's disease means multinodular goiter, which has hyperthyroid state. These are the primary hyperthyroidism. And for the secondary hyperthyroidism, secondary hyperthyroidism means secondary. What do you mean by secondary? Secondary means it's not from the thyroid gland. Rather than thyroid gland, we have to think. For example, if you take about the regulation of the thyroid hormones, first from the hypothalamus, thyroid releasing hormone will secreted, right? And it will reach the anterior pituitary gland. From there, it will stimulate and secrete TSH hormone. TSH hormone will go and stimulate the thyroid gland, and from the thyroid gland only T3 and T4 hormones will be secreted. So if the problem, as I said earlier, if the problem from the primary thyroid hyperthyroidism, if it is primary means problem here in the thyroid gland itself. So secondary means rather than this thyroid gland, problem should be in this any regulation center, right? So if we can think the problem can be in the anterior pituitary. So in the pituitary, the problem can be TSH secreting pituitary adenoma. I mean, like, pituitary adenoma can cause. So if the pituitary adenoma was there, it will secrete more amount of TSH, right? It will produce more amount of TSH. So due to that, it will cause thyroid gland to produce more amount of T4 and T3. But you can think, like, in this state, in this secondary hyperthyroidism, the thyroid gland is normal, right? It looks normal. Only the TSHoma only, like TSH secreting pituitary adenoma only giving TSH high, and due to that only the thyroid gland is secreting more amount of T4 and T3. But here the thyroid gland is normal, so that's why we are telling it secondary, not primary. So that is, these are the causes of the thyrotoxicosis associated with hyperthyroidism. And other one is not thyrotoxicosis not associated with hyperthyroidism. For that we can tell transient thyrotoxicosis, I mean, like acute thyroiditis. In the acute thyroiditis, we know, like, in the acute phase, initially the thyroid hormone level will be suddenly increased, and later, in the later period, the the thyroid hormone will be less. So in the initial stage, it will be hyperthyroidism, and in the later stage, they become hypothyroidism. And struma ovary means, in the ovary, the more than 50% of the mass of the ovary will contain thyroid tissues, so it will produce thyroxine from there. And factitious thyrotoxicosis, I mean, factitious means the patient is taking from the outside. And here is like, you have to know this: all hyperthyroidism are thyrotoxicosis, but all thyrotoxicosis are not hyperthyroidism. This one you should remember, and this will be very helpful. And I think you may understand now the difference between hyperthyroidism and thyrotoxicosis. In the summary, that, like, both are not same. Hyperthyroidism and thyrotoxicosis are not same. The, like, hyperthyroidism patients, okay, all the hyperthyroidism patients will be thyrotoxicosis, but all thyrotoxicosis are not hyperthyroidism. Okay, that's it. Thank you very much.